Welcome back, everybody. Time now is 6:41, and in your good health. As kids get older, parents start to let go of the reins a little bit and allow them to have their independence. But should this apply to your child's health care when they get into their teen years? It's a good question, right? A new CS Mott Children's Hospital poll covering this very subject shows 2/3 of parents are filling out health history forms without their child's involvement. They tell researchers that they do that because their teen isn't comfortable doing it themselves. Those parents also say only 15% of their kids would discuss health problems at a routine checkup without parents. So joining us now in studio is Dr. Matt Davis to discuss this very topic. First of all, when it comes to filling out those forms, just break it all down for us. When should parents sort of let go of the reins?
We recommend that parents, when their kids are 13 or 14, start having this conversation before the visit to talk with their kids and say, you know what, you're getting old enough now where you can start answering some of these questions.
Right.
And work forward till they're filling out more and more of that form, because when they get to be 18, 19, we're going to be expecting them to do that on their own.
Right.
But starting to do that for the first time at 18 or 19 is probably too late to have that good sense of independence.
Right. So it should probably be a gradual thing. Maybe as they're getting into their teen years, you're kind of sitting them down next to you while you're filling it out, letting them know maybe about parental history, family health history, and that type of thing?
Exactly right. This is a practice makes perfect type of situation where introducing this process to your teen earlier on in their adolescence can really pay off down the road in terms of their sense of autonomy and independence.
Now, when it comes to teens not filling this out, what type of concerns do you have as a physician?
Well, and I'm hearing more of the parent's voice on that questionnaire rather than the teen's voice. I know at least I'm hearing from somebody, but I may not be hearing from the patient, him or herself. That's an important part of the visit, too, in terms of making sure that the teen who may be a little reluctant to speak on their own does get that chance, filling out the form, and then also talking one-on-one with us as a healthcare professional.
Now, when it comes to them actually turning 18 and them having to fill this out on their own, what problems can you foresee if they're not able to do that as a teenager?
An adolescent who hasn't had practice, whose parent hasn't given them the space to fill this out on their own, may not be informed, as you were alluding to earlier, about their family history, and may not, in fact, know how to answer some of the questions about their own health behaviors. They may be reluctant to share that information.
Gotcha. Of course, this is a good conversation to have with your child, with the teen at your house, or the tween, I guess you could say, as they're getting into those teenage years, so that they know.
It all depends on how independent your teen or tween is feeling, but it's really never too early to start introducing your kids to these forms and the information that we're hoping as healthcare professionals that they're going to feel comfortable sharing.
Very good advice. Thank you as always.
Thanks, Everett.
We appreciate it. Ron, we'll